My name is Sanjay Gupta. I'm a cardiologist in York. Today I'm really pleased to introduce someone that I've been speaking to over the last couple of weeks. This is Jonathan Gilbert. Jonathan, you're the owner of Defib Machines.
Yes, I am.
Excellent.
We started a couple of years back, 2016, with the main focus of trying to address and help people have access to defibrillators, making them affordable and reliable as well.
So I, as you know, am a cardiologist, and I have to say the most devastating thing is that patient or that person who's not even a patient yet, who is completely well and then has a sudden cardiac arrest. That is absolutely devastating for the family, really scary for everyone who knows that person, because one minute they're fine, next minute you hear that they've died. And the problem I have found is that a lot of medical research is based on those people who make it into hospital. If we think about it, we don't really do very much for those people who don't make it to hospital. All those people who drop down dead suddenly in the community, what are we actually doing for those people? And to my mind, there are only two things that can help that person, because you can't predict it beforehand. You do start worrying and you start becoming very conscious of your own mortality.
Yes.
So when I looked into this, I said to myself, well, what are we doing for those people? How do we empower our community to help those people when they need it? And there are two things. One, obviously, resuscitation training.
Yeah.
And I personally think resuscitation training should be mandatory in schools. Everyone should be well versed in resuscitation. And the main purpose of resuscitation is to allow defibrillation, particularly if patients develop ventricular fibrillation, which is what most cardiac patients unfortunately get, a rhythm incompatible with life. At that point, the thing that will potentially get them out, their best chance, is early defibrillation. Now, I know that lots of centers in the community are now have now got defibrillators available. And when you got in touch, it became very exciting for me, because I wanted to find out, how do we do something good for the community, and how we go about allowing people better access to good machines which work, and which then may just make a huge difference to someone's life.
No, absolutely. In terms of the UK, we don't have fantastic support. We do not have great response rates. Unfortunately, we have a survival rate of less than 8%, 7.8%. Currently, that's on the latest stats that have come out for cardiac arrest. As you mentioned, it's kind of out of hospital we really need to be focusing on, and that's the current stats say there's on average 30,000 a year occurring cardiac arrests, sudden cardiac arrests outside of hospitals. 100 of those a week actually happen in the workplace as well, which is a huge stat. There is the unfortunate truth, we spend a lot of time at work, so if it's going to happen, it is one of the places that is likely. The other percentages happen at home, or they happen in public places, and it's really making sure that, okay, across those three, how can we really spearhead and make sure that we are getting people that quick defibrillation. Being able to get a defibrillator on someone in the first 5 minutes is absolutely key. 3 to 5 minutes is ideal. I mean, if you can get it on someone as soon as possible, that's the best. Your chances of survival drop by 10% every minute that you're looking at. And having a pressure on the NHS or a reliance, which, I mean, the NHS are absolutely fantastic. Having defibrillators available really provides a support to the NHS that helps the ambulance services job start before they even arrive. If you're able to get a defibrillator on someone, you're not waiting the 7 minutes, which is the target time for a category 1 for a cardiac arrest. That's the target time. In reality, the average is actually 15 minutes. Both of those are too late. Having a defibrillator available and having it within a 2-minute journey, so 2 minutes to it, 2 minutes back, and a minute to administer it, that gives you that 5-minute window. it can increase chance of survival significantly. Having that access in workplaces and communities, and really we should be looking at how we can support people at home as well. But the way that defibrillators are distributed in the UK, there's generally 3 different options at the moment. So there's funding, there's purchase, or part funding also falls under purchase, and then there's rentals. The main things that always need to be looked at is quality of device and what support is actually being provided going forward, because getting a defibrillator is actually just the start of that journey.
Yeah.
It doesn't solve the problem all of a sudden and that's going to sit on the wall and work whenever it's needed. It just doesn't work that way, unfortunately. So when looking at getting the defib across all of those, you want to make sure that firstly the device is an FDA approved device. It is a standard that's set in the US. It's generally recognised across the world as the gold standard. We don't have standards in the UK around defibrillators. We have the CE mark, which will be pointed towards, but generally that's just an electrical device being approved. And then there's also the Medical Healthcare Regulations Association that will point towards defibrillators, but it is not to the same level of checking that these defibrillators are able to perform the things that they're claiming.
You've mentioned, so what is staggering is that if I have a cardiac arrest today at home, what you're saying is that there is an 8% chance I'll survive.
Unfortunately, that's currently the stats, yes.
Is that because that's just the nature of the beast, or is it because of a lack of resuscitation training and a lack of defibrillator availability?
I mean, education is absolutely key. People understanding how they work, as you mentioned at the start, having education in schools is fantastically important.
Absolutely.
It creates generations of lifesavers. First aid and basic life-saving are fantastic things to have. In September 2020, it was actually brought in that all school leavers will now learn from 12 years up how to perform first aid and basic life-saving BLS, which makes a huge difference for us all of a sudden. But we're 3-4 years into that now. We've got a huge generational gap. So education is something that is really lacking in this country, and is one of the reasons, which is a barrier to people using defibrillators, and the reason why we have these low survival rates. Other countries have been doing this for many years. Nordic countries, Scandinavian, France, Germany, Italy, these countries have been doing it for a very long time. You see survival rates in these countries of 30-40%.
Really?
And there's actually Seattle in America is even above that. It's a fantastic area for it, and they also have a real program in terms of access to defibrillators in public places, in communities, is superior to pretty much anywhere else in the world.
So why is the government not taking this? Surely that's perhaps the most important thing to do to improve the health of the community, because for lots of people, a cardiac arrest, they're getting on, they're completely healthy, they have a good quality of life, they're getting on, and suddenly out of the blue, they have the cardiac arrest. If you could defibrillate them early, if you could help them survive that, there's no good reason why they wouldn't continue to go back and live a reasonably good quality of life. Yet, a lot of our focus tends to be on those people who are very sick, who have lots of comorbidities.
We've got a system called the Circuit. The Circuit is NHS, Microsoft, and British Heart Foundation. They've come together, and it's essentially trying to map the available public defibrillators in the UK. It's a system in its infancy, and I mean it's great in the opportunities that it's giving. Obviously, it isn't perfect yet. There's still a long way to go with it, but it does give us a tool that we didn't actually have before. The information previously was just held by the individual ambulance services, so that then became difficult when you were crossing different paths. If you went through to a call handler in a different area, they actually weren't able to access that information. So they will direct anyone to a defibrillator within 200 metres. You're talking about the time that you need to be able to get the defibrillator, being able to provide the CPR as well. That's the kind of distances that's being used.
So my question, I suppose, is in the Scandinavian countries, what are they doing so differently compared to us?
The two main points are, as we mentioned, education and accessibility. It's recommended that you should have refresher training every 3 years. It's also said that you don't have to be trained to use a defibrillator, and that's true. They are designed that anybody can use them. They're incredibly simple and they are fantastic. I don't know anybody who the first time they see a defibrillator working, they want it to be when they're using it in anger.
Oh, absolutely. Gosh, I mean, it's so, in theory, it's all very well, but in reality, there are so many other complexities that come into the mix. I mean, I had one of my friends died very recently.
Yeah.
Again, and his wife noted that he was very unwell. And she rang and they said, oh, bring him down, pull him down, and then start compressing his chest. But she was saying, well, how do I support his head? What if his head bangs? Well, these are very real things. We never think about that. We just think, oh yeah, drag the person down. But if you're on your own, how do you drag a person who weighs 80 or 90 kilos down? How do you stop them from their head from banging? Because that, for a family member, that's horrendous. Could I break the person's neck? Could I do something?
So the more that are able to be in places like cities, but also workplaces. Workplaces is a huge one, as I mentioned. 100 a week happening in the workplace is a huge number, and it's the kind of situation that people say, well, it's never going to happen to us. Our business was set up with a focus on trying to support small, medium-sized businesses be able to provide defibrillators and not breaking the budget. With that focus of the fact that actually if something like this does happen, it affects the entire workforce. It affects so many people around it.
Oh, absolutely.
So it's making sure that they are available in workplaces, they are available in public places. We're very good in this country at having advisory positions. So we will tell people the best position to have a defibrillator. But we don't tell anyone that they have to have them specifically, which you can take either way.
What is the one single thing you would do now, knowing that our success rates in terms of resuscitation and survival from cardiac arrest are so low?
Yeah.
What one thing do you think you could do which could make an immediate impact? Not immediate, but which is going to give you the best bang for your buck in terms of helping the community?
So for helping communities, for what we always think, I don't want to sound like a broken record, educating. So we make sure that we're educating people with every defibrillator that goes in. I don't think there should be any reason why a defibrillator is installed and people aren't trained. There are free tools online, but seeing one on hand first impressions is really important, in knowing that. But there should also be training going forward that should be included. There should be more responsibility on the experts who are providing defibrillators. There should be more guidance to understand the types of defibrillators which are effective, and making sure those defibrillators are working when they're needed most. They can't just be an ornament that are put on the wall and forgotten about. So I would say educating people so that they know how to use them, and going forward they know what to be doing. I would say making sure the defibs were trustworthy and reliable, and I would also make sure that people were within a vicinity of being able to do it. So if you are able to add a defibrillator onto the circuit, it's absolutely worth doing. But again, that does link back round with putting ones onto the circuit. It links back round to further support being given from people who are giving the defibrillators out. If you provide a defibrillator, somebody buys one, puts it onto the circuit to help their local community, and that defibrillator is used, people then have to replenish parts, pads, batteries. They can cost £300-400 to be doing this. And that can happen a number of times. And that shouldn't be the case for people buying a defibrillator, looking to support, looking to help people going forward. Our stance is that any defib that is used, there is no bill to it. There's no bill on pads and batteries, because it's like buying a laptop for £1,000, going home and then being asked to pay £300 to go on the internet. It has one job, and if that job comes with a bill, you're only going to put people off and those defibs are just going to go into disrepair and not work when needed. There's a lot of fantastic work that's gone on with defibs in the last few years and defibrillators to make sure that people are comfortable, confident, and educated around them. That will be eroded if people aren't looking after them and people start to see that defibrillators aren't working. And that has to come with a responsibility being from the people that are providing them, are looking after them, giving that extra care, and making sure that people are comfortable in actually using these devices when it comes to it. Because, like you said earlier, it can be anyone, any age, any time. There are no signals or signs around it, and it's an unfortunate, terrifying thing. With the way that we work, and we replace every defib actually when we've had it used. The reason we do that, like I say, there's no bill. We make sure pads and batteries are replaced, but we replace every device within 24 hours. We're making sure that it's available. We're making sure we're not doing our servicing on site. A defib really should be serviced after it's used. The other reason why we really want to do that is there's a human aspect to a defib being used, and allowing people that clean slate, no matter what the outcome is, we think is just a nice human touch to be doing.
So when I discovered about my friend dying like this, I looked into purchasing a defibrillator for my own home.
Yeah.
Because the truth is, if you ask me where is the nearest defib, I don't know.
Yeah.
The second thing that I have to say is I'm a cardiologist. I should be trained in this, but actually we're only expected to renew our ALS every 3 years. The whole thing has been made so complex, and the more you start looking into it, so you want to book yourself on a course, it's like, oh, £2,000. So one thing I find very upsetting is that even if you want to learn, you can't access it, partly because they're booked and partly because they're so expensive. The second thing is, when I started looking into the defibrillator, I discovered that you could buy a defibrillator for about £1,000 or something like that. And I said, okay, that's not too bad, I'll get that. But then my concern was, okay, I can put it in my house, but how do I know it will work when it's needed to work? Yeah. How do I know that my family are going to be adequately confident to be able to use it should the need ever arise? This is the big problem. It has to be an active thing, and you have to be talking and being educated and by the person who's providing it. You want to be able to contact them and get them to come and check it and ideally that should happen automatically, shouldn't it? Yeah. It should be a case. So in that sense, that put me off buying it, because I thought, well, once I buy it, I don't know what to do with it, and maybe it lies there and gets redundant because we don't need to use it. But what happens when we do need to use it? So in that sense, it became very interesting to me when you approached me, because what you're doing is you're renting defibrillators out, aren't you?
Yeah, so the way that we provide defibrillators is we are providing them on a rental with a fully serviced and maintained package around it. The reason we've done that is when I originally came across defibrillators, I was blown away by the stats and figures around them, but at the same time was completely blindsided by the fact that I'd never come across defibs. I'd been involved in first aid through my life. I'd been through martial arts. I had to be a trained first aider in that. I was a trained lifeguard, and I'd been around first aid, but I'd never come across defibrillators. This was some time back when I was young, but still. I couldn't understand why that was the process. When I found out about defibrillators, I didn't know why they weren't readily available in the UK. And in understanding that, I did find that there were a couple of main reasons why. As you say, they are expensive to purchase. That can put people off. They don't understand them. We haven't got that education. As we mentioned, that is going to improve in coming years, but we haven't got that there. And people don't understand the service side. They don't understand the support that's needed. It was generally large companies that had a large budget to be able to spend. They didn't actually mind spending £110 a person to train them, to spend £200, £300 on pads and batteries every 2 to 4 years, £1,000 on a defib every 5 to 8 years, because these things have lifespans. And the messaging at the same time before we started was also something that was of concern to me. It was very much a case of, You can get a defibrillator, put it on that wall, and that will be absolutely fine. And there wasn't the responsibility that we now see, which is a slow change, but that is better than no change. What we've seen change since we entered the market, our focus became, as I mentioned, making reliable AEDs an affordable reality for everyone. That's our company vision. We want to make sure that people can afford them, that budget isn't a reason to be able to save somebody's life. And if somebody reaches for that defibrillator, they have full confidence that's going to work. That's why we have 100% success rate when a defib is used in an emergency as well. So the things that we really changed, and what we wanted to make sure that were in there, was servicing as a standard. Defibrillators are recommended to be checked every 2 years. And it's not just a case of pressing a button and making sure that it's talking to you. These things, they're professional pieces of medical life-saving equipment. There are very few things like that people will say that'll look after itself. So the testing levels that we do, we follow the FDA standards. So we follow the expectations that will be set in states across America. We also follow the standards that will be expected in mainland Europe and some of the countries we've already mentioned that have high survival rates. In doing that, we have seen a complete change in the way that people provide defibrillators now. The same position of these things look after themselves and they're simple is now followed with, but we also provide servicing afterwards. And personally, the more people that do that, the better. It's great to see that responsibility coming around. We're hoping that further changes come. We think that pads and batteries should be included. That should not be something that customers are paying for. We think training should be included, as you mentioned. That industry there is a growing industry in that, and there is a lot of reason why that needs to be there with the certification and keeping the qualities, but also we need to make sure that we're not pricing people out of these things. We need to make sure that people understand them, they have access to it, and not just defibs and that. Choking hazards or burns. There's a lot of things that are basic things that would help day-to-day life and quality for people. You never know when the defib's next needed. And we want to be making sure that we are providing it in that time and are making sure that that defib is back up and ready to work for if somebody needs it again.
So can I ask you, you say your mission is to make it affordable.
Yes.
And that I think is the most important thing. Could you give me an idea of what affordable is? How much does it cost for me to, if I came to you and I said, look, I have this real dilemma. I've lost 2 friends from cardiac arrest.
Yeah.
I'm in that age group where that could be me one day.
Yeah.
I want to do the best I can to try and maximize my chances. So I live in an isolated farm. I would like a defibrillator for my household.
Yeah.
How much would it cost me?
So in terms of rental and the way that we provide it, we include everything that I've mentioned, and we do it at £1 a day.
£1 a day?
£1 a day, yeah. £365 a year. We've done that to try and make it simple, understood. You can budget for it. There are other options. So if people do want to purchase a device, you can buy one for between £800 and £1,500, which can be expensive. Pads and batteries, as I mentioned, every 2 to 4 years need replacing, and I'd always recommend getting servicing. Some people just will not rent, and I'm fine with that. My mission is not to rent every defib in the country. It's make sure that people know about defibrillators and actually have access to them. So if people are purchasing them, I would always say, make sure it's a quality defib, make sure it is FDA approved.
Sure.
It is the gold standard and you know that it's going to work. There are many defibs in this country that do not have that level. And it's not for me to say the quality of those, but my trust would always sit in an FDA device. There has been developments and new entrants into the defibrillator market in the UK, which can become very confusing. I don't know if you've looked at defibrillators or purchasing one, you kind of provided with a catalogue of different options, and they talk about biphasic shocks, monophasic shocks, and lithium-ion batteries, and it all is jargon.
Ultimately, all you want is something that saves your life. right?
Absolutely.
So, do you provide this only to companies, or can individuals come to you? How do individuals? Because you see, all these things become interesting when someone says, some politician comes along and says, "Oh, we're going to open up a new defibrillator in your community center," and it becomes a photo opportunity. But
Yes.
to my mind, I think it's a really good idea that if someone can afford it, to have a defibrillator in their house.
Yeah.
If you know, ideally, if you can afford it, or at least in your block of flats, something that you. So at the moment, I think that the initiative is very much on the person who owns the building, or the building contractor, or the community head, or whatever. If a person, an ordinary person, wants to take that initiative and say, "I think this is a good idea for my family. I think this is a good idea. I've got two parents who've had heart attacks in the past." It's always a possibility. You know, you've already declared yourself having had a heart attack as someone who's at a higher risk. So, how do I access it? For a lot of people, they wouldn't even know where to start, you see.
Yeah, in terms of ourselves and how we work, we actually only work with businesses currently, which is the only way that we're actually able to provide the devices at the price that we do. However, there are other options. We're not the only company that that provide them out there. What I would say is, you make a really good point about photo opportunities with defibrillators.
Yeah.
There was a bill that was put into Parliament last year, which hit the nail on the head. The pads and batteries are just about to run out, and it becomes a burden for the people actually in that area who don't have responsibility for it and don't know what to do or where to start. And as you say, where do you start if you're not aware? So the bill that was actually put forward was for every new housing development to be provided with a defibrillator, but also with 10 years of support going forward, of service, of maintenance. And that's the direction that we really need to be going, because that would make an initial change overnight. If people had access to defibrillators in the same way that there was phone boxes originally, kind of in the 90s, you would never be that far away from a phone box. If we had that kind of view of a defibrillator as a utility, it would make a huge difference and alleviate a lot of pressure on the NHS and the ambulance service of being able to get there within that 5 minutes. In terms of supporting communities, we recommend every defib that goes into a business to provide that to their local community, put it on the circuit. It can go in a cabinet, or it can be made actually available on the circuit within their working hours, so you can always let it go through that. We can work with community groups, we can work with sport groups and things like that. So we are able to provide it, it's just on an individual basis, we're not able to provide them. There are developments and changes that have happened. There's talk of personal defibrillators, which have differing levels of shock energy to what would be normally seen as expected. So kind of 120 to 150 joules as an entry, you wouldn't be getting that. That's the kind of thing that, like I say, we would always say, if it's an FDA approved device, we would recommend that, and that's the best angle to go with. But as new defibrillators come out and new angles come out, the main thing that we actually need to be making sure is the clinical data there to support, to show that these devices are effective and that they work. If we're able to have more devices available in personal spaces.
The finances, I mean, to my mind, £1 a day is very affordable most of the times for something which could actually save your life. You have to see what it actually can do, right? I
Completely.
In terms of that, even the idea that actually I'd have to spend £500 to replace the battery in the pads, but that's nothing, because it's just saved my life. That's when
you're able to actually do it.
You know, exactly. So, I mean, I think it's genuinely very exciting what you're trying to do. The fact that you can make it affordable, and the fact that you can maintain it, etc. The only thing that disappoints me is the fact that we cannot make it available to the end user, and it becomes again a problem where people are beginning to realize that it's the middlemen who are hampering this kind of progress.
the way that we work with businesses, we hear about the success stories that we have. We have 100% success with every defib that's ever been deployed.
What does that mean? So every defib that's been used has saved someone's life?
Yeah, has worked as exactly how it's meant to. We've got some great examples as well of defibs being used. The education facility who placed a defibrillator, we provided a full site survey, so we checked the campus and we recommended the places to put it. They had 7 installed originally. We went around and installed them and provided the training. We took an entire day to train as many members of staff. We had a drop-in centre so that anybody who wanted to see and learn how to use the defib could do that, and we actually provide that every 2 years still. That defibrillator, or one of those defibrillators, was used a month later on a 54-year-old lecturer, and it saved his life. And the training was actually implemented by somebody who was at one of our drop-in sessions, so it shows that process really working in that situation. We've got an example of a venue that we provide to. We provided a site survey with a recommendation of a certain number of defibrillators, and it was decided that less would be needed than that. But at 6 AM, a contractor in his 40s had a cardiac arrest. One of the devices was retrieved on this person, and it saved his life as well. Since then, the venue have increased the number to the number that was originally provided. There's also defibrillators provided in cabinets to make them available to the local communities as well, which is fantastic to see. We provide to a huge number of motor dealerships throughout the UK. One of the main reasons is because of working with electric and hybrid vehicles, you have to have a defibrillator available. So there's been a large number that have been provided, and we manage a large number of fleets for that. We're the only company actually set up to do that in the UK. So we provide that management. We're providing and installing over 100 different sites for this one company. We installed the defibrillator, we put it with the first aid kit and with the burn kit, so it was obviously accessible where it was, and we did the training. Our technician left, and then we had a call from the head office to the head office, which told us 45 minutes after that defib had been installed, a customer had had a cardiac arrest in the MOT bay, and that defib had saved their life. So these things, the messages that we actually get to hear back are fantastic, because we have that contact with an end user as well. It's not a case of contact us as and when, and maybe if you want to replace your pads and batteries. That maintenance and relationship building it provides us that ability to know what is happening and keep on top, giving these successful stories.
Knowing what I know, knowing the delays in the system, knowing the fact that the healthcare system is not about individual patients, it's about populations, and it's about data, and it's about, like, we saved so many lives and all this kind of stuff. But my life was important.
Yes.
And, you know, whilst you could say, well, we saved 8%, you know, for that one person who isn't that statistic, that's their whole family deprived of a breadwinner, you know, so
and not just a breadwinner, they lose the relationships that they've had, the possible memories moving forward. I would say on that, there is a difficulty in the fact that it is a system that needs to be fixed.
Absolutely.
And the starting point, there has to be a starting point to get to an end point, and to be able to catch up with our neighbours, to be able to catch up with other Western developed countries that are showing much better response rates. We need to start from a certain point, and being able to provide a reliable network that people have confidence in, that are kept up to date, and setting that as a ground standard for people who are providing them, that will allow us to have these building blocks. And then once we're able to provide as a community, the next step obviously from that is that personal position, which, as you say, it's the exact position you want to be in, because I feel important to me and I feel important to the people around me, but it's being able to provide en masse and being able to make sure we can protect that, and then we can start to filter down. But making sure, we've got to make sure we walk before we run with that. In terms of cardiac arrest and heart attack, obviously there's a real difference in those two that the layperson may not know. I feel like you are probably far better placed to actually explain that than I would be.
Ultimately, the issue is this, that a cardiac arrest is when the heart is not generating any kind of meaningful contraction to push blood around. So cardiac arrest is the same as death. There are lots of things that can lead on to cardiac arrest. So, you could bleed someone to the point that they have no blood left and eventually they die of cardiac arrest.
Yeah.
But the most common cause of unheralded cardiac arrest is usually a heart attack in middle-aged people. So what happens in those people is that over a period of time, they develop wear and tear of their heart arteries through bad lifestyles, etc. And sometimes it can just be genetics, sometimes it can be age, sometimes it could just be bad luck. But for some reason, a vessel blocks off, and when that vessel blocks, the heart, the territory of the heart that vessel is supplying with blood will suffocate. And when it suffocates, the heart starts dying. And at that point, the heart may develop heart rhythm disturbances, which render it ineffective. So ineffective that no blood comes out, and that is a cardiac arrest. So a heart attack is not the same as a cardiac arrest. A cardiac arrest is death unless you do something to actively reverse it. A heart attack may not necessarily result in cardiac arrest, but the problem is people develop the blockage and then they get the cardiac arrest and then they don't get resuscitated in time. They don't have access to things like defibrillators. And by the time they get to hospital or by the time they get help, too much damage has been done. And therefore, it is not possible for the heart to recover its function. And that is why time is so important. And that is the idea is you want time equates to how much damage is happening to the heart. The quicker you can get them out of the cardiac arrest, the more likely it is that you will be able to save them, and the more likely it is that they won't be left with permanent damage, particularly to the brain. And that is why it's so important.
I mean, the basic of that, if the heart's not working, there's not a lot else going on. And just to simplify for my mind, what you're saying, cardiac arrest is the electrics and heart attack is the plumbing.
Yeah, absolutely, absolutely. Ultimately, everything boils down to the fact that the heart as a pump is unable to pump out any meaningful amount of blood.
Yeah.
And so everything starts suffocating.
Yeah.
So what you have to do is you have to restore the pumping function. Yeah. And sometimes you can do that by resynchronizing the electricity, which is becoming chaotic. And that is what defibrillation does.
Yes.
But of course, it is possible that the heart becomes so weak that even if you resynchronize it, the heart is permanently damaged, and therefore the person will have another cardiac arrest and another cardiac arrest, sometimes in quick succession within a course of minutes. And that is again why it is so important to minimize damage by getting in there as soon as possible. And so it's a simple case of making things available and accessible so that you can get in there quickly. Yeah. And the problem is that even 7 minutes is late, but the reality is with ambulances, etc., it's 15 minutes.
Yeah.
And then on top of that, if you add in them coming into the house, then putting the things on, working out what's going on, that's already going into 20 minutes.
Yeah.
And that is why the survival rate goes down with, as you say, with every minute, the survival rate is going down, the likelihood of long-term damage is going up.
Yeah, and the obviously following on from a successful resuscitation, people going to the hospital, it's often that you would have an ICD fitted. I've been asked on many occasions about ICDs and also pacemakers and defibrillators. What's the position with that? And I know there's a lot of worry from people. My view is always that if somebody has gone into cardiac arrest in that situation, they have a pacemaker or an ICD, those things haven't done the job that they're meant to be doing. So a defibrillator will take them out of cardiac arrest and give them the opportunity to get to hospital, and they'll be able to make sure that those devices are working. But I'm guessing that people will usually get those devices because the heart's been weakened by the heart attack in the prolonged period.
Yeah, so this is the thing that I do. I mean, at the moment, implantable defibrillators are reserved for those people that we think are highly likely to develop a cardiac arrest, so people with weak hearts.
Yeah.
But the problem with people with weak hearts is that you're not reversing that weak heart. You are just reversing the likelihood of the cardiac arrest. They're still going to be left with a weak heart. So the substrate hasn't been taken away.
It's like a crutch.
It's like a crutch. And in some ways, you know, particularly those people who are really sick, maybe you're doing them a disservice by putting in a defibrillator because you are prolonging life at the cost of anything, right? Whereas the young guy who's working, who's happy, who's playing tennis, suddenly collapses. Now the thing is, he is otherwise healthy. This has just been an isolated incident.
Yeah.
You go, get in there, shock him quickly, have if there's a blockage, relieve the blockage, and he goes back to a normal existence. Obviously, we've left traumatized by it,
Yes.
but physically, he's able to do all those things. You have actually genuinely saved his life and allowed him to go back to a good quality of life.
Yeah.
At the moment, the rationing is such that defibrillators or implanted defibrillators are only reserved for those people who are really sick, who have got very bad hearts, etc.
Yeah.
So I'm not saying that those people should not be offered that, but I do think there is something to be said for those people who are really healthy, who are doing everything, and if they have a heart attack out of the blue and left with a bit of a scar, they should have access to defibrillators, because that scar itself can become the substrate for future cardiac arrests.
That's interesting.
I think it's initiatives like this that are going to make a difference to the community. I really do. I mean, this is what we need, and I'm so glad that you got in touch.
Perfect. No, it's been great to actually be here and talk and be able to talk passionately about something that I am passionate about.
Great. Nice talking to you. Thank you
Thanks
so
very
much.
for your time.
Excellent.
Cheers.